So would you like, Mr. Vice Chair, would you like to call this meeting to order? Mr. Vice Chair?
Yes.
Okay. This meeting is being recorded for the minute-taking purposes, as well as for posting of the recording of the proceedings on the agency's website. This meeting is also being live streamed on the Access Health CT website. Thank you, Mr. Chair.
Thank you. This is Paul Philpott. I'm the vice chair of the board, and I'll be the presiding officer this morning in the chair's absence. It is requested that participants introduce themselves every time they speak, and roll call votes will be taken prior to and for every action item. So, Marcin, would you like to do attendance?
Yes, Mr. Vice Chair. Charles Klippel. Paul Philpott, Vice Chair.
Here.
Grant Ritter.
Here.
Deidre Gifford.
Present.
Thank you, Dr. Gifford. Steven Hernandez. Matthew Brackman. Thomas McNeil.
Here.
Dina Berlin.
Here.
Andrea Barton-Reeves, DSS Commissioner. Sean King from OHA.
Here.
Claudia Gaultier from OPM. Paul Lombardo from SID.
Here.
Thank you. Dr. Manisha Tutani, DPH Commissioner. And Caroline Zambetti, designee for Nancy Navarrete, DMS Commissioner.
Good morning, here.
Good morning. Thank you. Sir Vice Chair, that concludes the attendance.
Yes, and I understand there's no public comment this morning.
That's correct, Mr. Vice Chair.
Okay. So the next order of business will be the review and approval of the minutes of the last meeting. Are there any questions or discussion? There being none, Chair would like a motion to approve.
So would you like to have a motion to approve them? I'm sorry, Mr. Vice Chair, to approve the March 4th, 2024 special meeting minutes.
That's correct. Yes, thank you.
Okay, so Mr. McNeil made a motion. Is there a second?
I'll second. Mr. Swan.
Okay, thank you. Is there any discussion on the motion before us? Mr. Vice Chair, would you like me to proceed with the roll call vote for the minutes?
Yes, thank you.
Okay. Charles Klippel, Paul Philpott.
Yes.
Grant Ritter.
Yes.
Deidre Gifford.
Yes.
Steven Hernandez.
Yes.
Matthew Brackman. Thomas McNeil.
Yes.
Dina Berlin.
Yes.
Andrea Barton-Reeves. Sean King.
Yes.
And Claudia Gaultier. Thank you.
Thank you, Marcin. At this point, I'm going to turn the meeting over to our CEO, James Michel, to give us a CEO report.
And welcome to our April board meeting. I am James Michel, the Chief Executive Officer of Access Health Connecticut, and thank you for being here today. Before we begin, I want to share some news regarding recent recognitions of Access Health Connecticut by the Hartford Business Journal. In March, the Hartford Business Journal named Access Health Connecticut as one of the best places to work for in Connecticut for 5 years in a row. In April, Tammy Hendricks, Director of Health Equity and Outreach, was named one of the top 25 women in business. We are proud of these recognitions, and as it's a reflection of our dedicated and committed workforce. I'm very proud to be their CEO. In addition, I wanted to share that we are projecting at this point that Connecticut residents enrolled in health insurance through Access of Connecticut will receive over $1 billion in advance premium tax credits this year. This is the first time we would have gone over $1 billion in tax credits for the state of Connecticut, and in large part because of the Cover Connecticut effort that the state introduced several years ago that has really contributed to affordability in the state and for Connecticut residents. These tax credits makes health insurance more affordable by lowering the monthly premium payments our customers have to pay on a monthly basis. This helps us toward our goal of increasing the rate of the insured in Connecticut, and also helps us to address health disparities in the state of Connecticut. Regarding our meeting today, Holly Zwick, Director of Finance, will share the third quarter budget report and also the proposed operating budget for fiscal year 2025, which was reviewed and approved by the Finance Committee last Thursday. Technology costs are the biggest cost drivers for this year to our budget. We also anticipate an increase in marketing costs as a result of a rise in advertising rates during the presidential election period, which coincides with our open enrollment period. Holly will also give you an investment report. After Holly, Tammy Hendricks will bring you up to date on the Broker Academy. We are very impressed with the candidates who applied for the third cohort of students, and are looking forward to another great session this year. To conclude the meeting, Susan Richby of Legal and Government Affairs will give a legal and policy update on the Affordable Care Act. And before I close, just want to remind the board that you are all invited to the Small Business Summit, which is happening this Monday in Mystic. If you did not get an invite, please let us know. We'll forward it to you. But I believe a while ago we invited the entire board this Monday. It's in Mystic, Connecticut, the Mystic Marriott. Thank you again for attending today's meeting. I will pause for any questions before we move on. Mr. Chairman, this concludes my presentation.
Thank you. And James, so I think that at this point, Holly will give her finance update.
Yes, sir. Holly?
Thank you. Holly Zwick, Director of Finance, Access Health CT. Good morning, everyone. Thank you, Vice Chairman Philpott and members of the board. Prior to speaking about the budget, I would like to take a minute just to give you an update on our audit RFP. We are currently procuring audit services and will notify the board as well as the finance and audit committees when we have completed a contract with a firm for financial audit services. We anticipate having an auditor in place for the next cycle beginning after the end of the fiscal year. Next slide, please, Martine. This slide portrays the fiscal year 2024 budget versus actual summary through the third quarter of fiscal year 24. Access Health is $176,673 under budget at this point in the fiscal year due to timing. Our shared budget with DSS is $1.1 million over budget, and I will be addressing this in a future slide. Thank you. Next slide, please. Now, in more detail, on the revenue side, we're over budget due to stable interest rates and assessment revenue higher than projected. On the expense side, we're seeing some small savings due to a couple of personnel vacancies. Let's see here. On the expense side, we have spent more contractually on the call savings and operations due to Medicaid Unwind, which was slated to end on March 31st. Here. Next slide, please. I apologize. This slide shows the full fiscal year 24 budget adjusted after 3 quarters, which remains flat. Next slide, please. As I mentioned previously, on the revenue side, interest income has increased as rates have remained steady and assessment rates are higher than projected. On the expense side, we have spent more contractually on the call center, as I have mentioned, and operations due to the Medicaid unwind. On the equipment and maintenance line, it's also increased due to higher costs for system maintenance and IT enhancements, which rose a bit, with system enhancements predicted to start earlier than anticipated. Again, offsetting these increased expenses is a vacancy savings in salaries and fringe benefits. Next slide, please. There will be no changes to our shared cost budget with DSS for Q3. Are there any questions on the fiscal year 24 Q3 budget? I believe there's a vote on the next slide.
Yes. So there being no discussion or questions, the chair requests a motion to approve the fiscal year 2024 third quarter budget report operating as presented by the staff.
So moved.
Tom
This is
McNeil.
Gifford.
Seconded, Tom McNeil.
Mr. Vice Chair, I'm requesting discussion on the motion before us.
Yes, I asked for discussion and questions and there weren't any. So I asked for a motion and I think we got a motion in a second.
Okay. So we're voting Charles Klippel, Paul Philpott,
Yes.
Grant Ritter,
Yes.
Deidre Gifford,
Yes.
Steven Hernandez,
Yes.
Matthew Brackman, Thomas McNeil,
Yes.
Dina Berlin,
Yes.
Andrea Barton Reeves, Sean King,
Yes.
and Claudio Galtieri. Thank you.
Okay.
Thank you.
At this point, there's another vote, and the chair is asking for a motion to approve the fiscal year 2025 proposed operating budget as presented by the exchange staff.
So Paul, I think, do you want us to go through the presentation first? We
Yeah.
have a slide. Okay.
Yes,
All right.
thank you.
Okay. Go ahead, Holly.
Sure. Thank you, everyone. Holly Zwick again. The proposed fiscal year 25 operating budget is focused on similar strategic initiatives from last fiscal year, including investments in IT, cybersecurity, and health disparities to aid in supporting our mission of decreasing the number of uninsured residents, improving the quality of healthcare, and reducing health disparities. Next slide, please. Our fiscal year 25 proposed budget increases by a little over $3.5 million, which I will show in the next slides. Next slide, please. On the revenue side, anticipated grant income remains the same. Marketplace assessments increased due to a new assessment rate approved by the board last year, and actuals came in higher than projected. Interest income, however, is anticipated to decrease due to the interest rates. On the expense side, we are seeing an increase in salaries and fringe due to a 3% merit increase. Temporary staffing is increasing for additional resources to help with IT, CMS, and IRS audits. Now on to the next line item, which is contractual. That line item is made up of the call center, operations, marketing and outreach, and vendor contracted resources. This line item is increasing by close to $1.8 million due to increased costs in marketing, with 2024 being a presidential election year, as well as the call center incurring additional expenses and IT initiatives. The next line item of equipment and maintenance, which is made up of software licensing and system maintenance, along with equipment purchases, is increasing by approximately $500,000 due to an increase in APCD costs of roughly $323,000 and increased maintenance, IT maintenance, as we're always working on improving our systems. Additional initiatives are also driving costs up. Finally, travel has increased to $100,000 because we are able to travel more post-COVID, and travel has become much more expensive. Next slide, please. This is our fiscal year proposed shared budget with DSS, with no change to the overall budget. Our call center costs are increasing, but our shared costs with DSS are remaining the same. We have seen minimum wage rise with inflation as well as increased IT maintenance costs. The call center is the largest line item in our budget. To close the gap, we will need significant mitigation efforts. DSS and Access Health are working collectively with our call center vendor to continue to improve the quality of calls and to minimize wait time. We're also cognizant of the need to leverage all technology available and are increasingly utilizing texting and emails in the marketing department, as well as exploring the callback feature for the call center. We are also planning on going out for RFP for the call center later this year, as we are always striving for the best value for the exchange. Next slide, please. The fiscal year 25 projected reserve fund balance is approximately $19.3 million, which equates to 6.2 months of operational funding. This includes $796,352 carried over from fiscal year 24. Are there any questions on the proposed fiscal year 25 budget?
Let me raise my hand.
Go ahead, please.
So awkward on Zoom. Can you just go back to the travel budget, please? It went by
Yes.
quickly and I just didn't have an opportunity to see the numbers.
Certainly.
And overall, as a percentage increase, is this roughly in line with previous annual increases for Access Health? It seems a little higher to me, but that's just my gut.
So, Dr. Gifford, are you referring to overall or just
Bottom
the
line.
travel? Bottom
Yeah,
line.
no, sorry,
I think,
bottom line.
yeah, I think our expenditures reflects the increased revenues that we are receiving because of the increase to the assessment. So that's what's driving the increase in expenditures. But the need is higher than what we are asking for here, simply because the cost of technology has gotten so high. And particularly, we have a number of initiatives that the CMS and IRS have asked us to put in place. That's also driving us, driving up costs as well. So I think that if we the increase is very high, it's always high. Obviously, like most other organizations, the necessary resources that we need for our unlimited needs, there's always a gap. But we think this is a responsible budget for where we are. But the increase that we have here reflects the amount of revenues we projected to come in. So our operating budget is limited to the revenues that are coming in. And we had anticipated the increased revenue, the need for the increased revenue, simply because our costs kept on going up year in, year out. And we were eating a little bit more into our reserves, but also there are technology enhancements that we need to put in place that we weren't able to do in the past because we just did not have the necessary revenues, because the assessment dollars were shrinking while our costs were going up. I hope that was helpful, provide some clarity around that.
Thank you.
Mr. Vice Chair, Dr. Grant-Ritter has a question.
Yes.
And
Grant?
followed by Mr. Shonking.
Could you explain more about the 2023 carryover loss of $5 million? That seems pretty high, but it might be just what James was talking about, IT and projects that were necessary and had been delayed, probably because of COVID or something.
Yeah, Dr. Ritter, those are not necessarily losses. These are reserve. These are projects that started in 2023. They were budgeted and started in 2023. But they were encumbered against the 2023 budget. So we are carrying them as part of our reserves just for funding purposes. So they're all projects that started, that were budgeted for in 2023, started in 2023, but were not completed in 2023.
And the expense goes on. Okay, thank you.
Yes.
Thank you.
But they are fully paid for in the FY 2023.
Next question.
Just a general statement in that we anticipate going forward, that given that the number of the individual insured have gone up in the current year. So we anticipate in the next 2 or 3 years, the revenues would continue to climb, given that we have more people in the individual insurance business in Connecticut. So we're looking forward to more funding, and that will enable us to do two things. The one is continue to maintain our system, but also hopefully we're not required to ask for any increase to assessments going forward.
Thank you, James. Is there any further discussion or any additional questions on the proposed operating budget?
It looked like Sean King has a question.
John?
Yes, thank you, Mr. Vice Chair. Just following up on Dr. Gifford's question. So, the bottom line increase is about $3.5 million. It looks like about half of that is through increases in contracts, 1.8 million. Can you just break down that number a little bit more? There's a short description that it's related to marketing and IT initiatives, but if we could get a little bit of a breakdown on that. Thanks.
Holly, do you have that at your fingertip?
Not at my fingertips, but I'd be more than happy to reach out to you after the meeting with those exact figures and what the 1.8 is made up of.
But the categories, contractual, Sean, the biggest increase is our call center. That has gone high in marketing, as I indicated in my opening comments. We anticipate that because of the election year, at least in our history, presidential election year, the marketing costs, TV, radio, they almost double during presidential year, simply because if you want any airtime or screen time, you got to pay more simply because it's much more competitive. And IT costs, IT initiatives driven mainly by CMS and IRS, and sometimes, in some cases, actual projects we have to do to maintain our system, to upgrade. And those are the biggest drivers. And again, this is our best estimate is what the costs are going to be. But now, as things change, we will come back to the board and report to the board. However, if we need to, we could provide a very detailed breakdown by category after this meeting. But those are the biggest drivers in why they're going up. And now IT costs has been going through the roof over the last 3 to 5 years. COVID is a big reason, but the area is cybersecurity is probably the biggest reason why it's going up.
All right, that's all helpful. Thank you.
Marketing is another line item that is increasing about, out of that 1.8 million is approximately 600,000 of that.
And by the way, that's for the same level of effort that we've done this year. It's just the cost, the unit costs are going up.
Okay, any further discussion or questions? Okay, there being none, then the chair will request a motion to approve the 2025 proposed operating budget as presented by the exchange staff.
So moved.
Do I hear a motion?
Yes, so moved.
Seconded, Tom
Second.
McNeil.
Thank you.
We're voting on the budget. Charles Klippel, Paul Philpott,
Yes.
Grant Ritter,
Yes.
Dietrich Gifford, Steven Hernandez,
Yes.
Matthew Brockman, Thomas McNeil,
Yes.
Dina Berlin,
Yes.
NJ Barton Reeves,
Yes.
Sean King. Thank you.
Yes.
Sean King. Thank you. And Claudio Galtieri. Thank you.
Thank you. And now we'll have an investment report from Holly.
Thank you, Vice Chair. This brings us to the investment report, which we present biannually to the Finance Committee and Board of Directors. To briefly recap, the objective for the Access Health Exchange Funds is to obtain the maximum rate of return while preserving the principal and providing immediate liquidity. Access Health invests in the State of Connecticut Treasurer Short-Term Investment Fund, also known as STIF. This account is available for use by the state's funds and agencies, and state statutes authorize these pooled investment funds to be invested in the U.S. government and agency obligations. These investment pools are under the control of the state treasurer. Next slide, please. The year-to-date earnings on the STIF account are $851,909. Access Health Connecticut's investment portfolio is in compliance with our investment policy, and we can meet our expenditure requirements for the next 9 months. Next slide, please. I believe that Susan Richby, our legal director, was going to explain some of the legislation. Yes, thank you.
Thank
Susan?
you. Yep, thank you, Mr. Chair, and thank you, Holly. Susan Richby, Director of Legal and Governmental Affairs. We have a proposed change, which Holly will get into the details on, for our board-approved investment policy. And I just wanted to give everybody a little background because it's been a while, several years since we've made any changes to any of these policies, just on the process and why we are doing what we're doing. So we are a quasi-public agency, as everybody knows, and we are subject to the Quasi-Public Act and at Connecticut General Statutes 1-121 requires that quasi-public agencies must give at least 30 days notice by publication in the Connecticut Law Journal before adopting a proposed procedure or change to a policy or procedure. So that is why we are bringing this to the board today, and Holly will get into the details. And you have with your board packet a copy of the investment policy with the proposed changes all in red, so it's easy for everyone to see. Thank you.
Thank you, Susan. Our investment policy core remains the same. We have added a section on 457B administration along with 2 appendices, as the 457 plan did not exist back in 2012. We have also updated the title of officers to match our current organizational structure. Are there any questions on the investment policy changes or the investment policy itself?
There being no discussion or questions, the chair will entertain a motion
I
to
think
approve the.
it looks like there's a question from Dr. Gifford, Mr. Vice Chair.
Please.
Thank you. I just wanted to know if the Finance Committee had approved the changes.
Yes, I certainly. Susan, could you, can I refer
Sure.
to you on that?
Sure,
Thank you.
thank you. Dr. Gifford, it is the board's role to approve, and right now you're not actually approving the changes because we have to go through the public comment period. So the motion will be for it to be posted in the Connecticut Law Journal for 30 days of public comment. And then following receipt of any comments received and review of those, then we will bring it back to the board. It was presented to the Finance Committee last week, but there was no reason for them to vote because it is the board's vote to post it in the Law Journal. But it was presented and reviewed with them last week.
And did they have, thanks, Susan, did they have suggested changes or no?
No, they did not.
Okay,
Sorry.
thank you.
Any additional discussion or questions? Okay, there being none, the chair will entertain a motion to approve posting the proposed amendment to the investment policy in the Connecticut Law Journal for 30 days of public comment. Do I hear a motion?
So
so
moved,
moved.
Tom McNeil.
Sorry, second, Andrea Barton Reeves.
Is there a discussion on motion before us?
I think there is no further discussion, Marson.
Okay, so we're voting Charles Klippel, Paul Philpott,
Yes.
Grant Ritter,
Yes.
Deidre Gifford,
Yes,
Steven Hernandez,
Yes.
Matthew Brackman, Thomas McNeil,
Yes.
Dina Berlin,
A lot of times in EMS
Yes.
organization.
Andrea Barton Reeves,
Yes.
Sean King,
Yes.
and Claudio Galtieri. Thank you.
Thank you. So now we'll have a Broker Academy update from Tammy Hendricks. Tammy?
Thank you, Mr. Chair. Good morning, everyone. Tammy Hendricks, Director of Health Equity and Outreach. Broker Academy Year 3 is officially underway. We've seen a significant increase in web page visits, questions, emails, leading up to the application launch at the beginning of March. And visits to the website actually more than doubled from February into March. And that's great because in total, we received 101 applications, which is a 53% increase compared to last year. And I wanted to note a few factors that we think led to this increase. First, last year, we started to promote the program at all of our outreach events throughout the year, really giving folks a heads up, providing, consistent reminders, which helped because people were more aware of the timeline of the program this year. And we also found that in general, applicants were more prepared before applying this year. Another really big factor, of course, the continued help of our community partners. Past students really got involved this year, and brokers, especially those who participated in our mentorship program, helping us spread the word, played a major role in our successful recruitment this year. And we've noticed that applicants that are referred to the program by our partners, they tend to have a better completion rate. So for example, comparing years 1 and 2, we had less applicants last year, but we actually had a higher retention and graduation rate than we did in year 1. And I think the biggest difference there was most of the students in year 2 were referred by community partners or past students and mentors. So based off of this trend, we're expecting even more of an increase in retention and graduates this year. And I'll touch on some more stats below. But right now, the teams are wrapping up the recruitment phase. We are moving into the application review process. Last week, the application team started to schedule interviews. And the goal is to have students accepted by the end of the month so we can start the program readiness meetings in the beginning of May. And for those of you who are not familiar with the program readiness meetings, these are weekly meetings that we put in place to get the students prepared for the in-class trainings. And in the past, students have told us how important these meetings were to their success in the program. So we went ahead and we added an extra meeting, weekly meeting for the students this year. So more to come on that as we plan those sessions out. But moving on to some stats, On the program applicants, we will start with referrals. More than half of the applicants, 53%, said they were referred from their communities to the Broker Academy. So this is including referrals from community organizations, their friends, their families. Some noted that they were referred by their case managers and community colleges. These applicants are having meaningful conversations with key members of their communities before applying. And we structure the recruitment plan that way, right? This was the goal, having more applicants come through from community partner referrals. Because while we know that this is a great opportunity, this program is a wonderful opportunity, it does require commitment. And that's hard for a lot of people. So especially for the applicants that we are looking for that are living and working in underserved communities. So having community partners participate in the recruitment process was so important, not only for the students, but for the program as well. 30% noted that they learned about Broker Academy directly from Access Health. We did a lot of Zoom sessions. We had a lot of promotions at events, newsletters, emails, phone calls. So a good chunk of students came in through referral directly from our staff. And no surprise here, 67% of the applicants identified as female. As you all know, the current broker community is male dominated. So it's always interesting to see the recruitment pattern of applicants, women applicants being the majority, really diversifying the broker community beyond ethnicity. And speaking of ethnicity, majority of the students or the applicants identified as African American, Black, Hispanic. And this year, we have applicants coming in from 37 different towns, representing 7 out of the 8 counties, most coming from Hartford County. And this year, we saw an increase in applicants from the Fairfield area, taking the lead over New Haven this year. And I think just in general, this stats shows the significant growth in just 2 years for the program. And finally, we have 2 class locations set for Capital Community College. Again, we are returning there. It's been very successful for the past 2 years at Capital. And this will be our first year at Norwalk Community College. Classes are scheduled for June 3rd to the 7th. So we're off to a really great start for year 3. More information to come as we get closer and start accepting students. And this concludes my presentation. Happy to answer any questions.
Tammy, very quick, can you give a context about why we went to Norwalk Community College?
Yes. So usually when we go into the Hartford area, we see a large turnout, but we recognize that there's needs all over the state. So we are looking in different areas that have higher rates of uninsured and higher rates of health disparities. We have done classes in New Haven and Bridgeport in prior years. So we have chosen Norwalk Community College to accommodate those students that are coming in from the southern end of the state, but also it's an area of need. So we did choose Norwalk strategically based off of data and from community feedback, community partner feedback.
Thank you.
Any questions for Tammy?
No questions, Mr. Vice Chair.
Okay, thank you. So Tammy, this is, I believe, a one-of-a-kind program in the nation, is it not?
Yes, it is. From what we know, we are the first exchange to do a program like this. And we've actually met with a lot of other exchanges who are interested in launching similar programs. So we're really proud of that.
Yeah, so I think this is a, you know, the program's a home run, and you guys have just done a tremendous job at this thing. And I think it's another case where Access Health is providing nationally some needed leadership in this area. So congratulations.
Yes, absolutely. Thank you.
So next, I think we have an ACA policy and legal update from Susan Richby.
Thank you, Mr. Chair. Yes. So for today, we wanted to touch on two items, brief update on the Braidwood versus Becerra case, and then the regulatory action by HHS Health and Human Services at the beginning of this month on the notice of benefit and payment parameters for plan year 2025. So Braidwood versus Becerra, as hopefully everybody might remember, is the very important case that's dealing with a challenge to the ACA's preventative services mandate, which, you know, as we all know, is a really critically important part of the ACA. This case was brought in Texas. It is now before the Fifth Circuit Court of Appeals to consider an appeal, the Justice Department's appeal of the lower court in Texas's ruling that struck down parts of the preventative services mandate. The appellate court did issue an order allowing the U.S. Preventative Services Task Force recommendations, which are the ones that are at issue here, which are really the most important ones for all the preventative services that we really like to see everybody have access to with no cost sharing, and the corresponding coverage mandate for preventative services to remain in place while the appeal is pending, so that there's no change in coverage for anyone under the policies right now. As you might imagine, lots of interested parties in this case. They've filed what are called amicus, friend of the court briefs, to express their opinions, and oral arguments were held in early March. We will continue to follow this case, and when a decision comes out from the Fifth Circuit, given the importance of this case, it is anticipated that it will go up to the Supreme Court after the Fifth Circuit rules, and we will continue to monitor it and bring it back up to the board. Next, I'll just give you a brief update on the notice of benefit and payment parameters for plan year 2025. As I mentioned, it was released in the final rule at the beginning of April. And just for everybody to note, there are now 18 states plus the District of Columbia, so 19 altogether, that now operate their own state-based marketplaces. And Georgia, Illinois, and Oregon are in the process of transitioning from using the FFM system to be full state marketplaces and using their own state system. Oregon's been an exchange, but was using the FFM system for a number of years. And there are also other states that are considering making the change. So HHS felt like this was a good time to maybe improve the process for states to transition, and also to set minimum standards for state marketplaces to ensure that everyone's on an equal level and equal playing field. So of those changes in there, one of the items that is of interest is a quantitative time and distance network adequacy standard. And when you talk, it's time and distance. So to make sure that members have access within, you know, they don't have to drive too far, too many miles, and it doesn't take them too long to see the specialists and providers that they might need to see under their plan. And the change is that states have standards that are at least as stringent as the one used by the FFM, the federal marketplace, for plans through the FFM. And this will start in plan year 2026. Connecticut, like many other states, has another entity. In Connecticut is the insurance department, perform the network adequacy review, and that is still permitted under this new rule. The ultimate responsibility rests with the state exchange, but we can continue to have the insurance department do that review for us. One of the other items that they came out with some standards on are some new call center standards. We've always been required to have a call center, and now with the increase in the number of state exchanges, they wanted to make sure that everybody's call center at least met a certain minimum standard. So the requirement is, one of the requirements is that you have live agents available during your hours of operations to assist consumers with the application and provide information about eligibility for financial assistance, and also facilitating the consumer comparison of QHPs. Here in Connecticut, as we've talked about, state statute requires that you have a license to actually advise a consumer on what plan to select. So the rule is not attempting to bypass a state statute in that way. So if Connecticut or another state has a law that has that requirement, the CCRs are not required to, go that far as a broker would about advising on plan selection, but just to give the consumer information to help them compare. One of the other items is also to align effective dates for special enrollment periods. And this is so that consumers can have coverage starting the first day of the month following the plan selection. Over the years, there have been some different rules about when the effective dates are, and now they don't want people to have a gap in coverage when they're coming in for a special enrollment period because they've most likely lost other coverage. Excuse me. One of the other changes is to add a check for enrollee death to the periodic data match that we have to do during the year, which now is for Medicare. And starting in 2025, we will also be checking to make sure that no one on a plan has been listed in some database as being deceased and making the plan changes for that. And they also are making a positive change. Incarceration status is one of the 3 items to buy a plan on an exchange. A consumer must not be incarcerated. And they are making a change to allow exchanges to use self-attestation that the person is not incarcerated, or to use a data source that is approved by the U.S. Department of Health and Human Services. And there are some other changes, but these are just sort of some highlights in there. And as I mentioned, some will go into effect in 2025 and some are in 2026. Thank you.
Thanks, Susan. Any questions for Susan?
Yeah, Dr. Gifford has a question, Mr. Chair.
Dr. Gifford.
Thanks. Susan, on the Braidwood case, for those of us who have not been following it really carefully, is the premise of the argument that the Preventive Services Task Force recommendations cannot be used as a basis for the preventive care, or what can you just remind us what they're arguing on the preventive care bit?
Yes, and I may fumble on because I haven't looked at that in a while, which provision of the Constitution, but the argument was that the preventative services mandate was unconstitutional. The plaintiff in the case, Braidwood, was an employer who was actually challenging the coverage requirement for PrEP. And that was at the base of their challenge, but they made it broad to the whole preventative services because they had a religious difference of opinion on, covering PrEP. But they attacked the whole preventative services mandate. And there are 3 governmental bodies that make the preventative services requirements that are part of the mandate. The bulk of them come from the U.S. Preventative Services Task Force recommendations. This is all the things that we know are so important, colonoscopies, mammograms, all of the preventative tests that we, want to see everyone having access to, and removing the cost sharing to make it more accessible. And the argument is, and I'm going to forget the exact word under the Constitution, but that the U.S. Preventative Services Task Force, the members of it or the task force itself, it's under the Appointments Clause of the Constitution, that it's not appointed. And Sean, I don't know if anyone else on here remembers that the appointment of the task force doesn't quite meet the standard. And that was the legal argument, the technical. They weren't attacking the actual, coverage that was put in there. It was a constitutional legal argument as a way to attack and knock out the whole all of the coverage for zero cost sharing for preventative services, but it was under the appointments clause.
So it's the legitimacy of the task force that they're questioning.
Exactly. And
I see.
Congress, I believe, I've read several articles, Congress or I guess Congress, there is a way to clean up the issue
Yeah,
under the appointments clause. So that ultimately could be a solution as well. And we'll just, really have to see what the Fifth Circuit Court of Appeals does. They tend to have rulings that follow with the lower court in Texas, where a lot of these
Yeah.
cases come up, which is why everyone is anticipating that this will probably end up before the Supreme Court.
okay. Thank you.
Thank you, Susan. So now I'd like to recognize James Michelle for a discussion of future agenda items.
Thank you very much, Paul. The items that we are focused on right now, we have three strategic initiatives. We have ICRA, which we have presented to the board, to the strategy committee. We are looking also, we've been working very closely with our partners, 10Clicks. Our 10Clicks project, this is modernizing our current system that's using 20-year-old technology, although our system is about 12 years old, but at the time, technology that has been used was already 8 or 9, 10 years old. So we have to update our system because it's very expensive to maintain, but it's also not flexible. If we have to make changes on the fly, it takes a long time to do it. And so very expensive because of how it was designed and built back in 2012. So we're looking at that. And also, I think, as Holly indicated, we are working on doing an RFP to go out to bid for a new call center, which is our biggest operating cost. And that is a shared cost with DSS. So everything we do along with our operational shared costs, DSS is a big part of that process of everything that we do. So those are the three big items that we're looking forward to keep the board updated on ICRA and our 10Clicks project, updating our current system and our call center RFP process. All three of a big lifts for us. The call center is extraordinarily just standing up a call center is a big operational task, but also a lot of risk that comes with that. And also, updating our system is also extraordinarily risky as well. So obviously, we got to be very, very thoughtful, what and how and who and when. So we'll keep the board fully abreast of what we're doing as we move forward, very strategically, but very deliberately, making sure that we don't expose Connecticut residents to any risk. At least minimize the risk that we expose our current customers and future customers to. Thank you, Mr. Chairman.
Thank you, James. Any questions or comments for James? Okay. There being none, do any of the board members have any additional comments or anything for the good of the order? All right. There being none, the chair will entertain a motion to adjourn.
So moved, Tom McNeil.
Second.
Second,
Roll call. Charles Klippel, Paul Philpott,
Yes.
Grant Ritter,
Yes.
Deidre Gifford,
Yes.
Steve Hernandez,
Yes.
Matthew Brackman, Thomas McNeil,
Yes.
Dina Berlin, Andrea Barton Reeves,
yes.
Sean King,
Yes.
and Calder Gaultieri. Thank you.
The motion to adjourn is carried. So the meeting is adjourned. Thank you for your attendance.
Thank you all.
Thank you.
Bye-bye.